dorsiflexion. It is this motion where your toe goes towards your shin. So plantar flexion, dorsiflexion. Why should you care about increasing that motion? Increased risk of plantar fasciitis. Deep squat mechanics. It can hinder descending stairs or running down a hill or even hiking down a hill. It leads to more knee valgus, more knee hyperextension, more load on that joint so that you have a higher risk for knee injuries, higher risk in low back pain. And there's also a lot of studies, one of which was on thousands of military men and women, that lack of dorsiflexion had the highest correlation with injuries. So why might you have lack of dorsiflexion? Maybe it's a previous injury like Achilles tendonitis or lateral ankle sprain. Just a soft tissue restriction. Maybe you have tight calves. You don't use it, you lose it. So if you're not doing anything that requires a lot of dorsiflexion, then maybe you just have lost that range of motion. You wear high-heeled shoes or shoes with just a little bit of a heel, like a boot. Or you play a sport with a lot of running and jumping involved. Here's the main test. You put your toes about 5 inches from the wall. Then you're gonna bring your knee to touch the wall without lifting your back heel. You want to make sure that knee goes right over your second toe and not veering off to one side or the other, straight there. If your knee can touch the wall, you're pretty good. But test it. See how far you can go back and when is your limit. Other supplemental tests include stepping down from a step, making sure that heel doesn't rise too early. Also testing your deep squat mechanics, seeing if you can get low without leaning too much at the chest or hyper-rounding in the lumbar spine. Another thing you can do is test your mobility of that fibula, which is that lateral bone. You can test it up here, proximal to the knee, or you can do it distally, closer to that ankle. Oftentimes with chronic ankle sprains, you have it more anterior or towards the front, so being able to mobilize that can help aid in getting more dorsiflexion. Now I'm going to show you some practical ways that you can work on your own dorsiflexion. First, I'm going to show you some passive things that you can do. A good way to start off the passive range of motion is just by rolling out the bottom of your foot. So what you'll do, you'll take a tennis ball or something similar like a lacrosse ball, it can even be a frozen water bottle, and roll back and forth, side to side, and really loosening up that plantar fascia on the bottom of your foot. Like I said earlier, that plantar fascia is highly correlated with that dorsiflexion, so just make sure that it's nice and loose before you start all the other exercises. A great passive exercise is when you get into kneeling. You're going to turn your tibia towards the inside, so you're just going to take your hands, grip your shin, and turn towards the inside of your body, and then you're going to rock that knee over top of that toe, getting a little bit deeper every time, maybe holding it for a few seconds and then coming back, just like this. Now, if you want, you can add a band to this activity. So I just have it attached to a tree. It can be attached to anything, but then you're going to put that around your shin bone, and it's going to do that work for you. So again, you're going to come over top of that toe, just like so. Now you can also start to do some outside and inside work as well to make sure that that dorsiflexion is good in all ranges of motion. That same kneeling exercise can be done with a target, so bringing a wall or something like that. And what you're going to do, just bring that knee right over top of that toe, kind of like the test we use. And then you can do 3 ways. You can go internal, external, working wherever you feel that restriction the most. And then you can also do lateral guides, so just working side to side in that max range of motion. So you're going to move your knee as far as you can forward, and then just turn inside to outside, keeping that heel down and working that dorsiflexion in all ranges. Once you've mastered kneeling on the ground, you can always bring it up to a bench and move that knee again right over that second toe. You can always add a weight to this and get further and further as you rock. However, you may have full passive range of motion, but you're not using it. So we're going to try some dynamic moves as well. The first move is down dog toe raises. So what you're going to do, you're going to get into a plank position, shift your hips back just a little bit, put one foot on top of the other, and we're going to go toe raise and then stretch that out. Toe raise, stretch that out. If you want to make it a little bit more of a stretch, just shift your hips back, your chest towards your thighs, and do it again. Another move are Panther Walk. So what you're going to do, you're going to get your hands right above your shoulders, your knees right above your hips, and you're going to walk backwards. If you notice, my toes are getting great toe extension, which is also great. My ankles are getting dorsiflexion as I rock backwards. So that's a good functional movement for your shoulders, your core, and that dorsiflexion. You can also do basic toe raises. or at a deficit where you put something underneath your heels. Another version of toe raises you can do is you start turning that toe out, okay? And so you can hold your shin bone facing the front. You're going to raise up that toe, turn it towards the inside, come down, press into the ground as you come back to start. Come up, press down as you come back to start. Another exercise you can do is toes elevated squat. Oftentimes you have your heels elevated in a squat to aid and when you don't have enough dorsiflexion to get a little bit deeper in that squat. But when we're working on increasing that dorsiflexion, this is a good way to do it, to have your toes elevated instead. So then you're gonna come down, making sure you're not leaning too far forward or over rounding that lumbar spine, but come down and come back up. You can always add weight to this or bands for resistance. So it's always a good idea to also strengthen up that ankle. So you can do stuff like plantar flexion, so pointing your toe against resistance. You can do stuff like dorsiflexion, so stepping on to something and pulling up like so. You can also do eversion this way and coming out with that foot. Or you can do inversion, so stepping other side and pushing in. This can be done in seated or even lying down, but working all four of those motions is really important for ankle strength and stability.